Welcome to another MU Healthcare Ask the Expert podcast. My name is Cosmo, and we are talking about concussions. With football season here and fall sports underway, we've got MU Healthcare neurologist Dr. Komal Ashraf with us, who is an expert in concussion care. And we're going to start with this question, Doctor. A concussion is considered a traumatic brain injury. Can you explain to us more about what actually happens with the brain when you have a concussion?
So a traumatic brain injury is impact to the brain, and that can happen from fast activity or movement of the neck or the head itself. The brain being in the skull creates impact where the brain hits and in the opposite forces also. And that can release chemicals that can cause tearing injuries, which then creates symptoms related to the injury that is there. It can be mild, moderate, or severe based on several different factors. But mild to moderate head injuries with symptoms is usually defining concussion.
What are some of the surprising symptoms or signs of a concussion that people overlook or miss?
So this one is very important to me because I think that the common ones obviously are common, but there's so many little ones that affect quality of life. I think of all of them fitting on one hand, the different categories. It's really important to address all of them. The easy ones that most people talk about: balance, coordination, vestibular things, dizziness, of course, headaches. Then it's really important, probably most important, to talk about sleep. You can have too much sleepiness or not enough, trouble falling asleep and staying asleep. You can have difficulty with mood, so more anxiety, more sadness, anger outbursts, changes in the mood. You can also have difficulty with cognition or thinking, so processing times, retaining information, planning, organizing, any of those executive functioning, frontal lobe kinds of things.
MU Healthcare neurologist Dr. Komal Ashraf is here as we talk concussions. How soon after a head injury should someone be evaluated for a possible concussion?
I think it depends a lot on what their daily activities of life are. So obviously, if someone is in their sport in the moment, they should definitely be evaluated immediately. There are so many different avenues for that. There can be urgent care and ERs, walk-in clinics, all the way to outpatient clinics. We do know that the signs and symptoms of concussion can evolve over the first 8 weeks. So anytime within that time frame, patients, athletes should have a more formal, comprehensive, thorough evaluation. So to answer your question, it should happen as soon as it happens, especially if there's some of those red flags and signs and symptoms that are worrisome, all the way out to past 8 weeks if needed.
Concussion's certainly not anything to mess around with. Listen to the doctors. Find out more. MU Healthcare's concussion program has got some great advice for you here. muhealth.org/concussion experts. Fall sports season is well underway. Football, of course, good time to talk about concussions. And while athletes in the contact sports are definitely at a higher risk, really a concussion can happen to anybody. A slip and fall in your garage or playing pickleball. I don't know. We got MU Healthcare neurologist Dr. Komal Ashraf with us here. And a lot of times for athletes, they don't want to risk playing time, so they think, I'll just shake it off, right? And I'll get back in there. What are some of the risks of ignoring a concussion or trying to go back to normal activities too soon?
Yeah, so I love that you said shake it off, because we have in our dean's office now, Dr. Ross Zafond, who's nationally recognized as a brain injury and probably globally even recognized as a brain injury expert, who's joined us in the last year. And he did research showing that shaking it off spontaneously after a head injury is a strong indicator of concussion. So it's really important not to just shake it off, so to speak, or go about your business without addressing some of those signs and symptoms we talked about before, because there can be long-standing consequences. I see players from the NFL that have suffered many concussions over time, never really got the help that they needed. And we see trouble with sleep, persistent, maintaining relationships, their hobbies of interest, staying organized, planning their memory, increased risk of dementia, a lot of difficulty with their mood and managing it, a lot of anxiety, of course, unrelenting headaches. All of those things can be long-term consequences.
How can MU Healthcare's concussion program help athletes safely return to the field, to the court?
Yeah, I love this question because I'm very proud of our concussion program, medical director of our program, and our goal is to get people seen soon. And using our very multidisciplinary comprehensive team approach of physical, occupational, and speech therapists, neuropsychologists, all the imaging tools that we might need, any of our electrical testing that we might need, and then medical care that helps address all those signs and symptoms that we were talking about. Mental health experts, psychologists, endocrinology, sports med, orthopedists, physical medicine and rehabilitation, and of course, neurology.
Having a great discussion this morning with MU Healthcare neurologist Dr. Komal Ashraf, an expert in concussion care. Certainly all the football talk going on Friday Night Lights, but my daughter played a lot of volleyball, and Emma had a really bad concussion at one time. You know, a lot of athletes feel the pressure to hide their symptoms because they don't want to lose playing time or they don't want to lose their starting position on the team. And you're saying, number one, obviously by hiding that, that's very dangerous. And number two, it's not the case. You can get back on the court. That's what Emma was able to do, worked back through it.
Yeah, that's absolutely correct. So we want athletes to report as quickly as possible because we want to evaluate them, get them on their trajectory to feeling better, doing better at the level they're used to. We know that going back to sport too early, at full capacity, at full contact, increases someone's risk for another head injury, which then makes their symptoms prolonged and harder to recover from. We also know that it increases their risk of a musculoskeletal injury by 50%. And that could result in crutches or surgery or torn ligaments or, fill in the blank. And so we want to try to prevent those things from happening, but still get people back to their cognitive and physical activities as quickly and safely as possible.
Yeah, concussions are nothing to mess around with. Listen to what the doctors, listen to what the experts are telling you. And yeah, you want to get it back out there on the court quick, but be safe. And like we've been saying, it is certainly not just football and the contact sports, right?
Definitely. So I'm a big sports fan as well. And I see athletes ranging from football to cheer to soccer to baseball, softball. I even have a couple athletes that do track and field that have fallen on a wet track, for example, and have gotten concussed. We see kids that are 6 and up, and I treat all youth concussions as sport concussions also. Kids are new to their bodies. They're top heavy with their heads. They're on the monkey bars. They're swinging. They're running. So there's so many different sports that actually can result in a concussion.
Thank you so much. Again, MU Healthcare neurologist Dr. Komal Ashraf, a concussion care expert with us on our Ask the Expert podcast. Learn more about how MU Healthcare's concussion program can help you or your loved ones. MUhealth.org/concussion experts.